WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. Everywhere you look, more and more apartments are going up across Charlotte. And now get this, the city is building more apartments than nearly any other place in the country. Coming up a bit later, the record growth and the good news for rent prices. But first, new data out this week shows Medicaid expansion is off to a booming start here in North Carolina. 400,000 people now with health care in the program's first 4 months. Joining us now is North Carolina Secretary of Health and Human Services, Kody Kinsley. Secretary, welcome back to Flashpoint.
Great to be here, Ben.
So in your view, has Medicaid expansion enrollment been successful?
Medicaid expansion has gone incredibly well. The hard work of our team, and more importantly, the hard work of grassroots organizers across this state have gotten people enrolled at a record pace. Day one, 273,000 people enrolled. As of April 3rd, we're at 417,000. That's just over 4 months. 400,000 people on. And our goal has been 600,000 people based off all analysis about who could be enrolled. We are only 4 months into this, and we are already more than 2/3 of the way to that goal. And that goal was supposed to be hit in 2 years. It's an amazing accomplishment because of the partnership and the hard work by so many folks who have worked hard to get this done.
I think the math says states enrolling at roughly 1,000 people a day. That rate outpaces other states who've made a similar push. Why do you think you've been so successful here?
Well, one thing, we made significant improvements to our technology over the last several years. So a quarter of applications when people go on to our website and apply are going through electronically without ever having to be touched by a person or an eligibility worker. That's great help for our county workforce, makes it easier for folks that are applying as well. We also have done some policy flexibility. So if you've applied for SNAP or food benefits in the last year, the income information that we got from that application we can use in your Medicaid application, so you don't have to double up and put information in twice. We also extended coverage for children already in Medicaid so that they didn't need to be redetermined, freeing up more workforce to focus on the new expansion population. All of that together makes our processing time right now for Medicaid eligibility 35 days roughly. That's 10 days less than the federal minimum expectation across the country. And so North Carolina is really plowing ahead full speed. We want to get folks covered. Most importantly, we want to get them care. And I'm excited to report that that's going really well as well. We've already had over 700,000 prescriptions filled for just the expansion population. And we've had over $10 million in provider claims get filled. So people are actually getting those prescriptions, getting that care that they need. And that all adds up to the peace of mind that we know Medicaid expansion provides for the people of North Carolina.
It makes you wonder, what were these folks doing, before this, say 6 months ago, a year from now, when they were probably not getting those prescriptions filled.
That's exactly right.
What do we know about the people signing up demographically?
Demographically, and first off, I encourage everyone to check out our dashboard online, and we update that every month with the latest information. First and foremost, people live in rural North Carolina, which isn't a surprise to us. We know that rural North Carolina was disproportionately uninsured going into this. What's great is that the access is actually getting tapped in those spaces. So Robeson County is our #1 county signing up as far as the percent of their population that is eligible and getting enrolled in expansion, and that tracks for other rural counties across the state. We also see it disproportionately serving communities of color who are disproportionately uninsured. 38% of folks that are getting enrolled are in that community, in those communities as well. And last but not least, it's an important reminder to everyone that 80% of the folks that are signing up are in working families. And by definition, these are people who are earning money, too much to qualify for Medicaid before, but not enough to be able to afford a plan through healthcare.gov. This fills that gap, and it helps these working families stay healthy so they can take care of their families and they can keep working.
We were not the last state to do this, although there's just a handful of states left. What would you say to those other states who are still holding back on this expansion?
Well, first and foremost, the dollars just make sense. North Carolina will bring in roughly $8 billion a year from Medicaid expansion and some of the other key aspects of the package that we put together to bring federal dollars into North Carolina. We structured it in a way that it was no additional cost to the state taxpayer. If I went to any General Assembly of any state and I said, here's a deal, you can bring in billions of dollars into your state without any cost to the state taxpayer, and you said no to that, I think as a board of directors, you would be violating your fiduciary responsibility. North Carolina saw the opportunity to do that, saw rural hospitals closing, behavioral health care patients languishing, and even heard from law enforcement that, look, we are serving these people in the wrong places because we don't have the preventative resources we need. People in jail have substance use disorder. Let's support them with the right tools for recovery to break those costly cycles. Without Medicaid expansion or not having Medicaid expansion is really an unfunded mandate on all of our local communities. Those are conversations we're having. I've chatted with some of my counterparts in other states across the Southeast, and I am eagerly hoping that they'll be able to chart a path that works for their state to get this done. I am so grateful to the General Assembly, to the advocates who worked for this for a decade, and most importantly to Governor Cooper, who built this truly unique coalition of people that don't normally all talk about healthcare to come together and to get this done.
Final question. I talked to you before this got passed. I talked to you during the process of it back before it happened, I believe in December. And I'm now talking to you now about it, and it's been a success. What has this been like for you personally?
This has been an amazing moment. I think folks know my personal story growing up in North Carolina without health insurance, seeing firsthand the real stress that my mother in particular would be under and trying to navigate having two young boys that would sometimes get hurt and figuring out how to navigate the health system, which can often be very confusing, but particularly challenging without health insurance. Getting it to this point, being able to really not just deliver on the policy objective and getting expanded coverage, but to then operationally work with our team to get it out so fast to the peace of mind just gives me such gratification. This has been a huge team effort, and it's been amazing to be a part of this team.
A full circle moment, not only for you, but probably for your mama as well. North Carolina Secretary of Health and Human Services, Kody Kinsley. Secretary, thanks as always. Appreciate it.
Thanks, Ben.
Still to come on Flashpoint, apartment construction is booming here in Charlotte. Next, why this is all good news for your bottom line.